Hi there, my name is Holly. I'm excited to show you what a natural holistic first aid kit can look like. So if you are just getting together yours, or maybe you have stuff, but you want to know what is best to have in your kit that you can take with you anywhere, then this is perfect for you. I'm going to show you what I use or what I have on me on a regular basis. And then also together with this, you're going to get some cheat sheets that show where I get these things, if I make them or where I purchase them, how I utilize them, what situations I would use them in, so that you can really feel confident as you're putting together your own natural health first aid kit. Now, I truly believe that we don't need to have pharmaceuticals in our first aid kits. This includes Benadryl and Tylenol and ibuprofen. That said, if you are someone who has a kid or a family member that has anaphylactic reactions, which are life-threatening reactions to substances, foods, or the environment, bee stings, something like that, then it's really important for you to have what you need in your kit, right? I'm not saying that you should never, ever have medication in there. However, I have seen that in most cases, we can treat reactions, we can treat illness and injuries naturally in a more safe and actually more holistically effective way, in a way that we are supporting our kids' bodies rather than just quenching the symptom and then causing more complications later. Okay, so with that in mind, let's go ahead. I'm going to show you what I have. This is my first aid kit. Now, believe me, I have many, many, many more remedies. And in many cases, most cases, I'd say I use food first. Now, but that said, we're going over the first aid kit. So this is what I have with me. If I'm going away for the weekend, or I'm going to the park, or I'm going to the friend's house or something, I usually will have this in a backpack with me that I keep in the car, unless it's extremely cold or extremely hot, because then I don't want the remedies to be in that environment. But I usually have something like this along with me. Okay, so yes, food is the top, which I go to first. Yes, I have remedies other than this, but this is my go-to pack that I bring with me to kind of make sure that I'm covered in a pinch if something happens. All right, so first I'm going to go over the remedies. So there's two sections to my kit, and you don't need to have a bag just like this, but I really like it. I think it's actually like a toiletries bag that you would bring with you traveling somewhere, but it works really well for this situation. So I'll show you the remedies, and then on the other side, I have more tools, bandage supplies, things like that. So we'll go through all of it. Also, remember that there is a cheat sheet that's accompanying this, right? So make sure that you have that. It might be helpful to print that out, have it in front of you as we're going through things. But I will make sure that I pull that up here in certain times throughout this video as well. Okay, so let's get started with our remedies. One thing that I do need to say, keep in mind, all of this is for educational purposes, right? I am not telling you right now, this is all you need. This is what you should do in this situation. This isn't medical advice. I'm simply showing you what I have here. But I will go over in detail how I utilize these. Just make sure that you're aware. You need to figure out for yourself in every situation what's appropriate, okay? And that's where parent-led health comes into play. Parent-led health is what I'm so passionate about. We are supposed to be parent-led, right? Our family should be parent-led, not doctor-led, not someone on the internet-led. You should gather your information so you feel very confident making decisions for your family's health. All right, so Antranex, this is one of my favorite products. Antranex is a standard process product, and what it is for reactions. I've used it for in situations of allergies, whether it's hives, whether it's bee stings in the body is creating a large amount of swelling. I've used this with people who have nut allergies and they've needed to take something really quick. Let's see, I've used this with, again, environmental things like bug bites that are swelling real big. I've used this with food intolerances. So any situation where there would be a high histamine response, this can be really helpful for. Okay, I had to stop really quick and shut my shade because that sun was becoming blaring or glaring. Okay, so Antranex is one of the first ones. I always make sure I have this on hand. Okay, so this is my kind of Benadryl substitute because it's that support for your liver to be able to help process out histamine in the situation of some kind of reaction. All right, then I have, let's go through more of the tablets first. Calcium lactate is another one that I have. Of course, I have a big giant bottle of this, but this is an easy way to carry it in one of these little pill bags. So calcium lactate is really helpful anytime the body is going through some sort of detox or a fever. So if the body is working on healing something, this could mean a bee sting. This could also mean flu-like symptoms or a fever again, or teething, or anytime the body is stressed and working on something, it often will use up calcium pretty quickly. So adding in some calcium, especially calcium lactate, which is a very bioavailable form of calcium for our bodies to use, so it doesn't have to go through lots of different conversion processes in our bodies to be able to be utilized. So calcium lactate is what I like. I, again, get this from Standard Process. I don't get everything from Standard Process, but these first few are from that company. And I will link to where you can find these for yourself. And if you get them through me, then you can get them at a discount. So that's a nice little perk there. So the calcium lactate, look on the cheat sheet for everything that I do say that I use it for. But again, anytime the body is stressed and working on something, it'll use up calcium quickly. This one in particular is 5 parts calcium to 1 part magnesium. And magnesium is the other one we want to have on board anytime we're utilizing minerals. We need to make sure that we're getting a good assortment of minerals there. I also use salt. I use salt frequently ingested to help supply the body with more minerals, like a good balance of minerals. A quality unrefined salt like a Celtic salt or Baja Gold is what I typically have on me. And so together with this calcium, which also contains magnesium, doing a little salt on the tongue of the person who is having whatever reaction or going through the detox can be really, really helpful, just to perk up the body, give the body that extra boost of mineral support that we need. All right, then Cataplex F. Now, this is just vitamin F, which is a combination of a couple fats that this is important. This one or other fats, I sometimes will use cod liver oil that has a concentrated butter oil with it. Usually I have one or the other in my first aid kit. And I do this together with the calcium because that will help just increase the amount of absorption that is able to happen. So the Cataplex F or that cod liver oil with concentrated butter oil, and that's listed on the cheat sheet, those together with the calcium are very helpful. So in the situations when I use calcium, I also combine it with that. And then I have some charcoal. So charcoal capsules, these capsules are really helpful for a few different things. So charcoal helps to remove substances. It also helps to bind. So if there's a situation of food poisoning, vomiting, something like that, we want to allow vomit to happen. I don't use antiemetics, which are suppressive, right? So if somebody is vomiting, we don't want to just suppress that. There is a reason why the body is vomiting, right? We don't want to just hold in whatever toxicity into the body. We want to let that get out. But using some charcoal ingested can be really helpful. Depends on the age of the child, if you're using this with a child. So I don't typically use this with babies, except in very specific situations that we won't go into right here, but this can be helpful with that. The other thing, the more common thing that I use this for is when we want to remove any kind of toxicity. If there's a bee sting or an ant bite, or if there is a wound that's extra dirty, something like that, I would make a little paste with the charcoal. I use this on tick bites. Every time there's a tick bite, I do this. I take the little bit of charcoal out. You can put it on your hand. It's going to be messy. It's fine. Put it on your hand with a drop or two of water just to make a paste, and then just put it on the area. So you're going to apply it to the area that has this, the whatever the thing is, the substance that you want to help remove. And then this can actually even help with splinters. I've seen that be helpful. So anything you're trying to extract from the body, that you can put that paste on. Depends on how you do it. Sometimes I leave it on overnight, but typically I'll do 10 minutes on, wipe that off, another paste for 10 minutes, wipe that off, and then a final one for 10 minutes and wipe that off. And often that's effective enough to just bring out, draw out whatever toxin is in there. All right, so that is the calcium, the Cataplex F, the charcoal, and the Antranex. Let's move on. All right. So I also have iodine in my first aid kit. This is Lugol's iodine. This one is 5%. There are certain companies that sell this, but Lugol's, Lugols, is what you're looking for the appropriate concentration of what you want. This is helpful with situations where there's a very dirty wound. Where you need to have something to help cleanse it. Now, when there's a wound, I typically am not showering it with water, soaking it in water, that kind of thing. I really actually prefer to have a wound bleed an appropriate amount, not excessive, and then do some kind of cleansing over top if it's really dirty. My kids are often outside and we have chickens and a dog and woods, and they're often getting really dirty. And if there's a situation where I'm like, you know what, if it's just kind of they're dirty, they stepped on something, they stepped on a stick or a thorn and it hurt them. Okay, we're gonna just kind of wipe that off. I'll actually put a probiotic on there, wipe that off, and they're okay. In a situation where maybe there's some poop that got in there because of the animals, or we're not really sure, they were kind of in a swampy area, we're really not really sure what's going on, I'll allow that to bleed because that's very cleansing, then kind of wipe it off how I can, and then take some of the iodine and just put it in the area just to allow for that area to be able to not have too much contamination as the body is working on getting things out. I don't use iodine all the time, but that is something that's nice to have on hand for those extra questionable situations that happen. So that is the iodine. All right, now I love calendula oil. Calendula is an oil that you can certainly buy it, and again, look at Fullscript, but I make it myself. So I grow calendula, and then I take a lot of those calendula flowers, I dry them, I put them in oil, leave it in a closet in a glass for about 4 to 6 weeks, and then I have a calendula oil. It's very soothing for the skin. It's very calming, and it reduces inflammation. It's just something that's really nice to allow the body to calm and soothe in a situation like that. So that's the calendula. Okay, next is one very similar. So this one is plantain. It looks exactly the same in my kit, but the plantain is the same process. Plantain does similar things. I found it to be a little bit more effective for when we need to draw things out, like a bee sting or a spider bite, something like that. So typically I'll use this when I am out of the house. It's the same process though. I take plantain, I dry it, I put it in oil, like an olive oil typically, for about 4 to 6 weeks, and then it's ready and I strain it out and I put it in my little bottles. When it's the season for it, which is most of the year here where I live in Tennessee, usually there's plantain leaves all around. So I'll just grab one of those, chew it up, stick it on the spot, and that usually really helps with the discomfort and with drawing out any kind of toxicity in there as well. So I like it fresh, but in my first aid kit, I do have this. All right, next is chlorophyll ointment. This is another standard process product that I really love. This is so helpful for wound care, for burns, really anytime we need the skin to be able to repair effectively and quickly. I love this. It's very, very dark. Let's see if I can show you. It looks like this. It looks kind of black, but it's actually green, and it will stain. So you want to be careful with it, but applying this to wounds that are quite significant. I've mostly used it with burns, and very, very irritating, kind of hives that are oozing, that kind of thing. That can be beautiful. So I love this one. I always have this on hand. All right, next is Rescue Remedy. So Rescue Remedy is something that is just really nice for bringing down a high stress situation. This is something that it says natural stress relief. This is a homeopathic product, and it can be sprayed in the mouth. I've even sprayed it on the chest, on the head. It kind of just depends on what's going on. And if somebody is frantic, they're freaking out, they're anxious, they're in pain and they can't breathe because of that, they're having a trouble breathing actually, and they're really struggling to allow their bodies to calm, to be able to breathe. I use that I use this product in those situations. So anytime there's a higher stress or higher emotional situation, I'll be using this. There are kids ones that look like this. This does have alcohol in it. It's a small amount, so it's up to you what you want to use. But I usually have the spray on hand typically, and then sometimes the pediatric one as well. All right, now we're going to get into some homeopathic remedies here. There are quite a few, and this really is kind of up to you for what you have found is helpful, what you think. So if you are a family that likes to use homeopathy, then I recommend really what you have seen successful, and but this is what I typically have on hand. So this is Apis. I've seen this be really helpful with certain kinds of bites and inflammatory responses. This histominum I've seen with allergic responses to things. Bryonia is put it on this side if it can be seen here. Bryonia is especially helpful in injury cases when it might hurt to have more movement. That's that situation. When the arm is hurt and moving is painful, that's when I'll typically use a bryonia. Arsenicum. So this one I have used specifically with situations like digestive unrest, so kind of that food poisoning situation, the nausea kind of thing. Nux vomica, again, another nausea support. Belladonna, has numerous uses like homeopathy does, but I have used this when my children have fevers. Arnica, which is really great on for bruising, bumps, injury type things, which happens all the time at my house. Ledum is my go-to when anyone in my family has a tick bite. It's also good for splinters. It's kind of when there's a puncture wound. So a splinter, or you step on a nail, or a tick bite, something like that. I've used it in all of those situations. And then Carbo-Veg is one that I have on hand. I've actually used it with animals more than kids, but it would be something that it's what it says is kind of for that shock near death kind of situation, which is quite intense sounding, right? But I have that just in case I ever really want to use that, or if I have the situation. On here it also says abdominal bloating with gas. So there's a lot of situations that I have in mind with homeopathics, but they can be used in numerous different ways. So that's something that I recommend you kind of doing your research, experimenting a little bit, having a couple of these on hand and seeing how effective they are for you, because it's homeopathy is a really lovely and fascinating kind of medicine where it needs to be specific for the situation. So, okay. So those are the remedies that I have right here. Those are the typical ones that I will have on hand. I'm going to, let me get these back in here. And then let's go through some of the more tools that I typically use. And I do actually believe I have a couple more substances here on this other side. Okay, so on this side, a couple different things here. Okay, so I have mostly my kind of tool kind of things up here, and then bandage supplies over here, but I kind of put things where they can fit. Okay, so let's see what I have here. These are called trauma shears. At least that's what I called them when I was an ER nurse in the hospital. Trauma shears. We'll cut through clothes, we'll cut through a cast, we'll cut through things like that. Kind of through a cast. It's a little hard, but if you have good ones. These are more precision scissors. So if I need to cut something, these are very, very sharp precision scissors. This is a Ticnado, which I do have this. Typically, though, I'll use a pair of tweezers if there's a tick instead of that. So I have tweezers here. These are also good just to have on hand for numerous situations. And then over here, I have some honey. So I really like to use honey. We actually used honey in the hospital in situations of burns. And I'll use it as a kind of probiotic support and a way to reduce likelihood of some kind of contamination or infection. So on burns, on different kinds of wounds, I'll often use a honey. Manuka honey has been shown to be the most effective, but really I have seen that a raw honey and unpasteurized honey even if it's not Manuka is very wonderful. So I do have Manuka, but also sometimes I'll use other honey in a pinch. Okay, and then some other things here. So as far as wound care goes, because that's something that we'll encounter a lot, right? So I usually have a couple of things of saline. So saline is just basically a salt water, a specific concentration of salt water. You can make it yourself quite easily, but I like to, in a first aid kit, it's just convenient to have a couple of those. Then I have, and actually I'll show you what I do use that for. Now, again, for cleaning, it can be helpful. Another thing is I use it for my nebulizer. So I do, this won't fit in this kit, but if I'm going over for a weekend somewhere, something like that, I'll bring the nebulizer, especially if I'm concerned about any respiratory status. And then I just use saline in it. I've seen that to be so helpful when we are dealing with coughs, when there's sniffles, when there's congestion, because the important thing is to keep things moist rather than letting things dry and get sticky. Then that's where you see some more infection kinds of things down in the lungs and in the sinuses. So I like to use that together with a saline like this to help support the respiratory system. All right, then there's different things. Now, I do have quite a few things kind of left over from my ER days. So packages will look different, but you can get a lot of these things either on Fullscript or at like a local CVS or Walgreens, something like that. So I have, this is a Steri-Strip. So this is kind of like a liquid bandage. I have a bunch of those. Dermabond, which is a skin adhesive for certain situations, but really kind of that liquid bandage can be really nice. I always have some gauze. So I have gauze pads and gauze wraps. I do have these nonstick dressings in here, but truthfully, if I am at home or somewhere where I can get it, I would rather use gauze pads with some tallow or some lard on it instead. And then I usually sprinkle a little probiotic on there. With a wound, it's really important for it to not be sticking, right? We don't want it sticking to the bandage, because then if we pull the bandage off, it's going to just reopen that wound, right? So it's really important to have a non-adhesive surface right against it. And so they do sell these, but I actually do prefer using some kind of fat and probiotic together on the gauze so that you're actually helping with the healing process. You're not just putting something on there that truthfully, some of the substances on here might not be what I actually want on my kids. And so using that is great, but I do have this in a bind in case I need that. Okay, then these are Steri-Strips. So these are the non-liquid Steri-Strips. These are helpful for when we need to bring a wound together. Kind of if we're out and we're like, oh, I can't really suture it up right now. I can't do stitches right now. This can be helpful in those kinds of situations. In the hospital, we would use them discriminately with depending on the kind of wound, but really when I'm out and about and not I'm not an ER nurse anymore. I don't utilize all of the things that they have there anymore. So these are really handy to have. This is just another kind of Dermabond. I like to have things like this, which are, it's called a Tegaderm. There's different kinds. So this is a clear bandage. So you can put something on top and then put this bandage on top of that. So you can kind of see what's going on the inside. It's also waterproof. So that's really nice. Even for simple things like a blister, something like that, it can be helpful just to get this on so that you can create a waterproof situation if you're out, say, on a hike or something like that. So normally we often do want to leave things open to air and not have it in like a tight plastic waterproof kind of thing, but sometimes it's really helpful to have this if you do need to keep it protected. They also have a bulb suction. So this bulb suction, this, you probably mostly see it for up the nose, right? You squeeze, go up, and then let go, and it pulls things out. Can be absolutely used for that. I also have used these for an enema. So where you take some saline or in a pinch some water, as long as it's sterile, it's been boiled or good water, filtered at least. And then you go like this and you suck up the water into here. And then you can slowly, if you put some fat on there, coconut oil, or even cream, not cream cheese, sour cream, or tallow or lard, then that can be inserted and slowly squeezed, very, very, very slowly, slower than what I just did, to allow the fluid to go into the rectum. And that can create a help for situations of constipation, but also in really dire situations of dehydration, that can be helpful. So I would make sure that there's some salt in there, that situation, but then, or use a saline in there. But then infusing that in can be helpful with dehydration. If someone's vomiting so much and they just cannot keep anything down, I've seen that be effective, and actually keep people out of needing to go to the hospital for an IV, which sometimes is totally appropriate, but this can be helpful there. All right. Let's see what else here. Okay, and then I do have some Band-Aids in here, and then some of these little butterfly Band-Aids that look like, let's see if I can show it on here well. That look kind of like this. Where can that go? There, like this. So these butterfly bandages that can help with bringing something together, bringing a wound together. And then these Band-Aids, I really like this brand. There's been a lot of information recently of Band-Aids, most Band-Aids company having harmful substances in them, and we just don't want to use that on the skin, because anything that goes on the skin will absorb in. So this is the brand that I'm currently recommending at the time of this recording, because they are conscious about what they are actually putting in the Band-Aids. And you can get these on Fullscript as well. That's where I get them. Okay, so those are the highlights of my first aid kit. Now, I want you to go ahead and take a look at the cheat sheet. And let me go ahead and pull that up. Okay, so here is the cheat sheet that you get together with this video. So if you go on down to, again, this good information here, and there is this link over here that you can get, that you can use to purchase some of the things that I have, that I've gone over, things that I use frequently. All right, page 2. So this is kind of the master list over here, things that I recommended, things that I mentioned. So there's the calcium lactate. If you look on this side, the calcium lactate, the USF, which actually I did not say because I don't currently have that in here, because I was using that, but the USF ointment is another one. It looks very similar to that chlorophyll ointment. It's also made by Standard Process, and it's really helpful to just have an extra fat. So fat on a rash can be very anti-inflammatory and helpful. I will use the USF together with the gauze when I'm making like that non-stick dressing that I was talking about. USF can be helpful with really any kind of skin irritation. It's an ointment, so it's all topical. And then the chlorophyll ointment that I mentioned, Antranex I mentioned. Allerplex is another one that I listed on here. I don't typically have it in mine, but sometimes I'll throw it in if my kids are experiencing allergies that are going on. Now, this is something I used to have, and honestly, we don't need this anymore. So I don't currently have it. However, I did list this. If your kids go through, have seasonal allergies, and it would be helpful to have something that's not a, over-the-counter antihistamine for more seasonal allergies versus like an event like a bee sting or something, then Allerplex can be helpful there. Cod liver oil capsules, I did mention these. I either use these or the Cataplex F that I showed. I also do like to use cod liver oil capsules for myself when I'm feeling run down or when I have a headache or something like that. Can be very, very helpful. For green pastures, I get the cod liver oil, fermented cod liver oil with concentrated butter oil blend. It's the one that I recommend. Rosita, you would just do the cod liver oil. Okay, then iodine, like I said, the Lugol's concentration, typically either 2 or 5% is what I use. Bandaging supplies. So I mentioned all of these things. A lot of them you can get on Fullscript, which is that link that I included there. Not all of them though, so you might want to get those on another place online or in the pharmacy near you, something like that. But typically, there's quite a few that you can get on Fullscript. So click on that list or that link and you'll see. Calendula oil, magnesium lotion, plantain oil, comfrey is another one I didn't actually say, but that is a helpful herb if you have it. These are all either you can make them or you can get some of them on Fullscript as well. So look over there. That arnica, the rescue remedy, those other homeopathic remedies that I mentioned are you can order them on Fullscript as well. Some health food stores will have them too. One other thing that I wanted to include here is bioplasma, which is a cell salt. Cell salts can be really helpful for a variety of things, and bioplasma is a combination of 12 that is really helpful in times of dehydration or in times when there's a headache or just feeling really run down. Again, the bioplasma can be helpful in that situation. Charcoal capsules, like I mentioned, honey, baking soda, I will use sometimes as a substitute for charcoal. If I don't have charcoal on me, I'll do the baking soda, but I don't usually have that in my first aid kit. Just something I wanted to recommend. And then a probiotic capsule. So this is something that actually, it gets lost in my first aid kit, so I didn't pull it out. But I do keep small probiotic capsules in my first aid kit. I recommend Smidge. I've used some other ones that I also like, but the Smidge is on Fullscript, so I included that one here. And I do really like this one, especially because it is one of the cleanest probiotics, if not the cleanest probiotic that I've found, meaning it doesn't have many allergens. So some other probiotics will have some allergens like dairy or soy in them, but Smidge is the most clean. Again, you can click the link down here for purchasing. Okay, and then this is more of the what would you use in this situation, right? So bump or bruise, if it's a closed wound, remember touching is helpful. Rubbing the area, hugging your child, physically comforting them actually does provide pain relief. They've shown this in studies that hugging and comforting and singing to your child provides pain relief, just like an over-the-counter pain relief could do. And then on the remedy and tool side, arnica, that magnesium lotion, comfrey oil or compresses, plantain, and calendula, that rescue remedy if it's a very high stress situation can be helpful. Okay, then on an open wound. So we do want to we want to control bleeding. We want it to bleed. Bleeding is important, but we need it to be controlled, right? We're not trying to bleed out. So bleeding does help with cleansing the area, okay? Filtered water and saline flushes can be helpful, but I don't recommend actually doing this right on. I'll usually do this on a fabric and then kind of go wipe off very gently. And then if significantly dirty, then the topical iodine, like I mentioned, can be helpful. So iodine, calendula again, arnica, there's so many options. And most people will say, oh, I have something else for that. Or, people who've been in the natural health world for a long time. But this is what I have found to be easy to have in the first aid kit, things that you can just have on hand. They are helpful. I've seen them be very helpful. So don't get bogged down with, oh, but what about this or what about this? If you find something that you really love, absolutely throw that in. I'm showing you what I have seen to be really helpful, what I love. Bandaging supplies. the probiotic capsule, I often will mix this together with lotion or oil. So maybe with a calendula oil or with the USF ointment, or with the plantain oil or something like that. I'll mix some probiotic in there and then put this on the area. It's really important. The body needs good bacteria to be able to heal. We can't heal in a fully sterile environment. So especially if we're doing something like topical iodine on there, then we need to get a whole bunch of good probiotics on there quickly. Topical honey, like I mentioned before, rescue remedy again, if it is a high stress and anxiety situation. So allergic reactions, airway breathing and circulation, we always need to be looking at that. If there is any lip or tongue swelling or trouble breathing or big signs of dehydration, there's an emergency happening, then this is a go to 911, call 911, go to the hospital immediately situation. If that's not happening, if it's not life-threatening, but you still need to do some kind of intervention, the Antranex, the Allerplex, like I mentioned before, the magnesium lotion, and rescue remedy would be my first. And then I do also use those homeopathics like the Apis or the histamine or something like that that might help in this situation. Bites and or stings. We want to make sure that the toxin or the venom is not causing emergent tissue death or damage. This is important. I say this because most of the time we are not going to see this at all. However, as a former ER nurse, I did see this. So we need to just make sure, is there black discoloration of the skin? Is there actually death of the skin? Is that progressing up? Are they out of it? They're not acting right. There's cardiac symptoms, their hearts are not working well. If so, anything else that's concerning like that, you call 911, you go to the ER immediately if you are very concerned. Otherwise, doing charcoal paste, like I mentioned, doing chlorophyll ointment, doing plantain, like I said, that oil, or doing it fresh where you chew it and stick it on, the Antranex, baking soda, similar to the charcoal. Those are things that can be very helpful. And then finally, yep, the last page here. So food poisoning, acute vomiting or diarrhea. This is where I would be bringing in what I said before. Sorry, the body does not vomit by accident. There's a reason for this. If there's something that's really urgent or emergent, call 911, go to the ER. Otherwise, doing that charcoal to neutralize, doing sublingual, so just some salt, like a quality unrefined salt like Baja Gold or Celtic on the tongue or under the tongue can be really helpful with this. The magnesium lotion that I mentioned, that can be very helpful. Rescue remedy, bioplasma, like I mentioned before. And then homeopathy as well, like the Nux vomica or the arsenicum or things like that can be helpful. Okay, then burns. So emergent burns can actually really quickly cause dehydration. They can be really severe and emergent, even if it is a sunburn. Like that can even cause us an emergent situation. So if it is emergent, you need to go to the ER. But make sure that you're doing all these other things too. So hydrating in those considerations with that sea salt, kind of the sublingual sea salt again, or ingested chlorophyll ointment topically, USF ointment topically, honey on top, bioplasma cell salt. And then there's also some homeopathics I didn't mention in my first aid kit because I usually do these instead. Skin irritations and rashes, you want to assess for if there is something else going on, right? Is there a burn happening? Is there a bite or a sting, right? You want to see like what is actually causing this. If there's nothing like that, if there's nothing emergent, then I'd be using the USF, the calendula, Antranex, chlorophyll ointment, and then I would also throw in here the probiotic as well. So in any of those oils or ointments, I'd add some probiotic there too. And then for fever, fevers are a sign that the body's working to heal. The height of a temperature does not necessarily correlate with the severity of an illness. This is something I tell my patients a lot because it's easy to think, oh, the temperature is 104. That is so much worse than a temperature of 101. They must be more sick. That's actually not the case. It's just a sign that the body is working hard to do its job and help to regulate and manage what is going on. And so, if there's an emergent situation, you go call 911 or go to the ER. However, for the most part, for fevers, I typically will use calcium lactate together with either the Cataplex F or the cod liver oil. We'll do the magnesium lotion, which can help with replacing minerals. I would also throw sea salt in here as well, or a quality unrefined salt. Cod liver oil, bioplasma cell salt, and then of course there's other food considerations, but those are the things with the first aid kit. Okay, so I know I hope this was helpful for you to have an idea of what you can do for your first aid kit. And again, just remember that this is a really good assortment of things for kind of what might possibly happen. You're never going to be able to predict everything, and it is okay if you sometimes are not sure what to do, but this will be helpful. If you want more information, then come find me on parentledhealth.com. And I have a lot more resources for you to be able to learn how to calmly, confidently, capably, skillfully, wisely take charge of your family's health naturally. So I would love to see you there. All right, I hope this was helpful, and I will see you in the future.